Hello there, I'm Dr. Chua Sooyong and I'm an orthopedic surgeon. Today I will be talking to you about the structures of the knee. Let's start with a knee model. This is the model of a knee. This is the inside of the knee, this is the outside of the knee. The inside of the knee is called the medial side and the outside of the knee is called the lateral side. Let's begin with the bony part of the knee. You look at the knee from the side, there is a big bone called the femur and there's a smaller bone called the tibia below. At the side of the knee, there is also a smaller bone called the fibula. In the front of the knee, there is a kneecap or the patella. Now, let's focus on the ligaments of the knee. On the inner side of the knee, there is a ligament called the medial collateral ligament, and there is another corresponding ligament on the outside of the knee called the lateral collateral ligament. The function of the collateral ligament is to prevent the knee from going sideways in a rocking manner or in a varus and a valgus direction. If you open up the knee and you look at the inside of the knee, you will notice that there is a ligament in the front called the anterior cruciate ligament. There is also a corresponding ligament behind called the posterior cruciate ligament. The function of the anterior cruciate ligament is very important in sportsmen. It prevents the knee from translating forwards and backwards. The function of the anterior cruciate ligament is also to prevent the knee from pivoting or rotating. It provides important stability to the knee. The posterior cruciate ligament is also important in providing forward and backward translation stability of the knee. Now, let's look at the inside of the knee. You will notice that there is a crescent-shaped structure on each side. Let's look at another model for a clearer depiction. If you look at this model here, you will notice that there is a soft structure which is like a crescent shape on each side. On the inner part of the knee, this crescent-shaped structure is called the medial meniscus. The other side, there is a crescent-shaped structure on the outer side called the lateral meniscus. If you see my finger pressing on the meniscus, it provides a bouncy support. Therefore, the function of the meniscus is to provide shock absorption. If your meniscus is damaged, you will get pain in your knee as well as clicking or locking sometimes. Now, if you focus on the other soft tissue part of the knee, you will see that this part is painted in blue and the bone itself is painted in white or ivory color. This blue area is called the cartilage. The function of the cartilage is to allow smooth gliding and flexion and extension of your knee in a smooth manner. Damage to the cartilage will result in early arthritis of your knee. Thank you. This sums up the function of the structures of the knee. Hello there, I'm Dr. Chua Sooyong and I'm an orthopedic surgeon. Today I shall talk to you about one of the most important soft tissue structures in the knee that is most commonly injured. This is the anterior cruciate ligament or the ACL. So what is the ACL? If you look at the knee model, you will see that in front, this is the kneecap. As I open up the kneecap, there is a ligament in the knee itself. This joins the femur to the tibia. What is the function of the ACL? The function of the ACL is twofold. Number one, it is to keep the femur and the tibia in good alignment, preventing the tibia from sliding forward on the femur itself. The second function of the ACL is to ensure rotatory stability of the knee. This is usually in the form of pivoting. When you land your foot on the ground and you twist it, the ACL prevents your knee from rotating in an unstable manner. Now, the ACL is most commonly injured in sports injuries. Usually in a traumatic injury, for example, a fall, a bad twist, or a bad tackle. Usually in the initial setting, the knee is in tremendous pain and you can get a bad swelling in the knee or a big effusion in the knee. After a few days, the pain may go away as the swelling settles down and you can end up with a knee that is typically unstable. This stability you can feel in that your knee is unstable when you run, when you walk fast, or when you turn your knee when your knee is planted on the ground. Sometimes climbing up and down the stairs, your knee may feel unstable. In the initial setting of rehab, it is important to ensure reduction in pain and swelling, and thereafter focusing on strengthening the muscles around the knee to give it good support. Thank you.
Thank you, Dr. Chua, for providing a very useful insight for the anatomy of the knee joint and the ACL injury. Okay, so in this clip, I will be showing you a few body weight and a light resistance exercises that would help with initial rehabilitation of the injury. So there would be minimum weight bearing. It is the goal is to improve the body awareness, slowly improve muscles strength, but more so towards the correct alignment and proprioception. So I hope you enjoy the clip that will help with your rehabilitation. Okay, first exercise, I will be utilizing a ball. I'm putting a ball behind the kneecap. I keep my knee bent on the floor. When I exhale, I'm thinking about straightening the knees, lift the toes up, relax your knee back down. I try again, straighten the knee, and then slowly lower down. So you notice that while I'm straightening the knees, I'm trying to visualize that I'm drawing my kneecaps all the way up towards my hip. Okay, this is one of the exercises that will help strengthen all of your quad muscles. Okay, your vasty muscles. Vasty muscles are important in order to be able to straighten your knee fully. Okay, it is those muscles that help with maintaining kneecaps in the right alignment. So you want to try to straighten your knees and maybe hold 1 second at the top and then slowly lower down. So not only this will help in the early stage of rehabilitation, not only helps strengthen the muscles, but also helps with proprioception. That you are not locking the knee, okay, the ball is supporting behind the knee, you're using the muscles to straighten the knee. We're trying to do this in the beginning, maybe 8 to 10 reps, 3 to 5 sets. You can have a rest in between each set. In the next exercise, I will be utilizing a flex band, which will give an extra resistance. Okay, so this is considered a progression from the previous exercise. So begin to lie down on your back. You can have your clients lying down, making sure that pelvis in neutral or imprint if your clients cannot stabilize the pelvis. Bring one leg up slowly, or the knee that is injured, have the flex band behind ball of the foot. Hold the flex band at the end of each of the side. The closer you hold the flex band to the foot, the harder the resistance. Okay, so maybe about towards the end of the flex band in the beginning, enough resistance, but not so hard that it's too much at the beginning. Begin to inhale to prepare. Exhale, slowly straighten the knees, pushing into the flex band. Hold it for 1 second, and then slowly, with control, resist the flex band as you return. We go again. Exhale. Same sensation as if you were doing with the ball behind the knee. Thinking about pressing the foot away from your hip socket. Visualize the ball behind the knee and pulling the kneecap up towards the hips. Think about using all of your 4 quads muscles, your vasty muscles, okay, and then hold it for 1 second and then slowly resist to return. So by using a flex band, you also want to work on the way back, that you are not just bend the knee, but thinking about resisting, thinking about pressing into the flex band. So you're working in the eccentric control of the return as well as the concentric contraction as you press out. It's an excellent exercise to building up strength slowly for the knee extension. And Return.
Another helpful Pilates exercise that will help with recovering from the ACL injury in the initial stage is doing knee rotation. Okay, so assuming my left knee is the one is injured, I'm reaching my knee out long and I'm thinking about stirring the pot with my toes. Okay, creating the rotation from the knee joint. Okay, as I do this, I'm thinking about keeping my thighs still, rotating from the knees to external, internal, straighten out. I'm doing this a few times. Okay, there is no resistance, but I'm thinking about stirring my foot against resistant water. Okay, and then reverse direction a few times. Okay, so thinking about a little bit of sensation of stirring into a nice sensation of water, nice and smooth fluidity. And maybe one more time. Good. From there, I progress to use a little bit of resistance with my knee rotation. Okay, I wrap a flex band around one of the dining chair legs, and I loop the flex band just where my kneecap is. Okay, from there I slowly float my leg up. So I'm gonna go in one direction only. So I'm thinking about pulling the foot away from the flex band, resist that flex band. As I return, I do it nice and slow. I go again, move the foot away from the flex band and slowly with the same pace as I return. Okay, so this is gonna help create a little bit of resistance, further provide more resistance from the previous exercise. Okay, I like to do this maybe 8 to 10 repetitions. Depends how fatigued your muscles get. Okay, so you want to do not too little and not too many repetitions that you're too sore in other area of your hip joint. So you should feel hip external rotation working. Maybe your inner thighs are engaging, and after 8 to 10 repetitions, it should be plenty.